Well, chances are you know someone who suffers from some form of mental illness, maybe within your own family. It affects 1 in 5 Canadians, but Canada has never had a national mental health strategy, at least not until now. The plan, 5 years in the making, will be revealed tomorrow, but tonight we can tell you that it calls for a complete overhaul of the country's mental health system and support that most Canadians have never had before. CTV's Joe Perkins reports.
Her name is Andrea Paquette, but she also goes by...
My name is Bipolar Babe.
Paquette's lived with bipolar disorder her entire life, and knows support is crucial.
People just don't understand. There's a lack of knowledge, and I think that if we did understand, we would have some acceptance and some empathy.
But Canada does not have a national mental health strategy, which leaves many Canadians, including Paquette, without access to psychiatric and psychological support.
Really, it touches every Canadian family across Canada. Whether you look at your own family, you see members of your family that are going through mental illness, or in the workplace. It's something that, it's a high priority for Canada.
Tomorrow, a report commissioned by Health Canada will formally be released, but details leaked early call for a major overhaul to Canada's mental health care system, including the need for more money, $4 billion more, as well as more than 100 other recommendations stressing the need for prevention and access to treatment, and the importance of working with First Nations and finding homes for the homeless. The Mental Health Commission will wait until tomorrow to speak to its recommendations. For now, these strategies are being called Canada's long-awaited blueprint, a national plan to deal with the problem of stigma that for so long has kept mental health issues in Canada quiet.
So many people that I talk to are affected by mental health issues, but then they don't want to bring it out because they're afraid of being judged, their kids being judged.
Facilities such as Our Place deal with mental health daily, but unlike other illnesses, mental health issues aren't tangible, meaning detection can be difficult. And after local attempts to raise support on Vancouver Island, some say it's about time for a national plan.
I think it's great for Canada. It's about time for Canada. I think that, most people across country have realized that there is an issue here in Canada and everywhere.
Unlike many Canadians, Bipolar Babe is open about her condition, an illness in Canada largely covered by a shadow. But Canadians such as Paquette have a new report on their side. The question now is what governments plan to do with it.
Joe Perkins joins us now with more. Joe, so to get some action on this, who needs to take the lead? Is it the federal government, or is this now up to the provinces and territories?
Well, Hudson, although it's a national strategy, it really is a call to all levels of government. The strategy itself says there needs to be engagement between all political leaders, federal and provincial, but many will be looking at Ottawa to take the lead. The health minister will be at tomorrow's official release of the report. On Monday, she said she's looking forward to it, so whether that means anything will come of it, we will have to wait and see.
All right, Joe Perkins, thank you.
You're welcome.